now going live on YouTube. Good afternoon and welcome. My name is Kristen Dawn Hefner, and I'm the Measure 110 Engagement Manager with OHA, and I will be assisting with facilitating today's meeting. The Oversight and Accountability Council welcomes and encourages community input. Members of the public are invited to submit public comments or get on our interested parties email list by emailing oha.measure110@dhsoha.state.or.us. And that email address and more information about the council can be found on the Measure 110 OAC website. OAC members have asked that OHA and other staff who are present in the meeting space introduce themselves in the chat. Please share your role with the agency, and if you are a subject matter expert, your area of expertise. I will now pass it on to Dharma, who is assisting with facilitating today's special meeting.
Hi, folks. I'm just going to call the agenda. We just have the rules discussion and some OHA updates. That's about it. Pass back off to y'all. Do we have to do attendance or anything?
Yeah, we probably should just for record. Just real quick, I see Sabrina's hand is up.
Yeah, I just wanted to make sure that I knew my place in the setting. Is the rules advisory discussion for information for us to receive, or is it to offer feedback?
Offer feedback.
Okay, awesome. Thank you.
Yeah. All right. Good to see everybody. I'm so glad we had a pretty good turnout for today. I was a little nervous, so I'm glad to see everybody. Some folks I know will be joining late, but I just want to make sure we have record of everyone who's here. So when I call your name, please say here. Amy. No Amy yet. Carlos. And just a reminder, this was not required, so not a big deal. Caroline. Dharma.
Here.
Hey, Dharma. Hubert.
Here.
Hey, Hubert.
Hello.
Hunter.
Here.
Hi, Hunter. Jackie Mercer. I do not see. Jonathan. Also do not see. Keisha. I'll come back to Keisha. Leticia.
I'm here.
Hey, Leticia.
I'm sorry. And Lakeisha's here. Sorry. I
Hey,
couldn't get to the
Keisha.
mute.
No problem. Thank you. Linda.
Here.
Hi, Linda. Melinda.
Here.
Hey, Melinda.
Hi.
Meredith.
Here.
Hey, Meredith.
Hello.
Morgan. No Morgan yet. Nicole. Oh, I just saw Anisha put here in the chat. Hi, Anisha. Ron. Oh, I see Amy's joining. I'll give her a second. Ryan.
I'm here.
Hi, Ryan. Sabrina.
I'm here.
Hey, Sabrina. Zeb.
I'm here.
Hey, Zeb. And then Sam is not going to be here. And Annalise.
Here.
Hello. And then I'm just going to go back. Amy.
I'm here.
Hey, Amy. And
Hi,
then
sorry I'm late.
No problem. Carlos, Caroline, Jackie, Jonathan, Morgan, Nicole, Ron. All right, we're set. We have quorum even if we didn't need it. So thanks for coming, everybody.
Great. Thank you for coming to this special session. It is optional and we won't be taking votes, so just note that, but we really do appreciate everyone coming. So with that, I think we have just a few slides to frame today's discussion. The purpose of this meeting is to gather y'all's feedback on the draft changes to the Chapter 944 rules. So this is in addition to the community engagement sessions and the RAC and the public hearing that will all be happening later on this spring and summer. Next slide. Thank you. So as a quick reminder, this council originally wrote and implemented the Chapter 944 rules that govern the Measure 110 program, but House Bill 2513, which passed in 2023, task the rule adoption to the Oregon Health Authority. So we have adjusted, reorganized, and streamlined some of these new rules based off of the original work that you all did. We really tried to make the changes technical, streamlining, and really honor the original vision, goals, and values that the council drafted all those years ago. Now, so we have distributed those draft emergency rules, and we'll use this forum for questions and any feedbacks on those drafts. Any updates to the emergency rules will be reflected in the permanent rules. This is not your last chance for feedback. We have 2 community engagement sessions that are open to the public, and OAC members are encouraged to attend. Those meeting dates are next week, May 20th from 9 to 11 a.m., where we will be kicking off the meeting and discussing the Division 010 rules, and May 23rd from 9 to 11 a.m. as well, where we'll be discussing the Division 020 rules and the next steps. There is also going to be a rules advisory committee. We are tentatively have scheduled that for July 9th, and members of the council will comprise at least half of the RAC. And all of you are encouraged to attend that meeting as well once it gets finalized and scheduled. We will also have a public hearing that will likely happen sometime in August. So all this to say is today is kind of a special opportunity for you all to weigh in, but definitely not your last opportunity. And there will be plenty of opportunity for the public as well to weigh in. Sabrina, I see your hand is up.
Yeah, I just wanted to ask really quick, are we still going to reference the Chapter 944 rules as Chapter 944 rules, even with the new House Bill 82 or 2513, I think? I'm not sure the exact number for the new House Bill. Will they still be considered Chapter 944 rules?
I'm not sure if the rule number will change, but we do have kind of one of our program staff who's been working on the rules, Jen, with us today. Jen, I'm not sure if you know the answer to that question. Otherwise, we can get back to you.
Hi, everyone. The chapter will still be 944. The divisions are additional new divisions. So currently we have division 001 for our burn rules. These are 2 new divisions. So we'll have chapter 944 010 and then chapter 944 020. So hopefully that's a better clarifier, but I'll be hanging out if anybody has any other questions.
Yes, thank you. You actually answered both of my questions. Thank you.
Thank you, Jen. All right, next slide. So the Division 010 rules, still Chapter 944, 010, the draft rules will become effective, and the final rules will become effective July 1st, 2025. So they won't interrupt current burns that are operating or affect currently funded Measure 110 partners. So no one will have to change kind of anything mid-grant. They are based off of the work that you all did at the beginning of this program. And as I kind of mentioned, the majority of the difference from the existing rules consist of removing unnecessary definitions, moving rules to new divisions, and to make some outline, give some outline and structure to the upcoming request for grant application or RFGA solicitation that will be out later this summer in anticipation of funding partners in 2025. Next slide. Thank you. The division chapter 944 division 020 rules are also kind of the grant program rules, and they specifically reference the application process, funding, and a new appeals process that House Bill 2513 dictated. And these rules will be the foundation of the upcoming request for grant application. As a reminder, this council will still have the final authority to approve grants, to approve funding for grants, and to terminate grants. And that is not changing. This is just, these rules are kind of teeing up how the application process will work up until that point. You all have also received a summary document kind of outlining the broad changes to the Division 010 and 020 rules. And they kind of break up what rule language pieces were moved or removed, hopefully kind of acting as a little bit of a roadmap to some of the changes that were made. Our main timeline goals are to make these temporary rules effective on 6/1/2024. Again, they're effective, but they wouldn't affect current partners. There's just a little bit of nuance there. And then we have 180 days to make the rules permanent. So these would all become permanent at the end of November of this year. So we are currently in the month of May, where we're doing this community engagement rack selection process, and we'll file the temporary rules. Next month, they will become effective. We will make sure we distribute these drafts to the tribes for a tribal feedback process. We'll also send out invitations to the rack. In July, the rack will meet and we'll file a notice of proposed rulemaking. In August, that will be posted in the Oregon Bulletin. We will have a public hearing and we'll kind of formally incorporate all of the feedback that we've received between today and that public hearing into the draft rules. In October, we'll file permanent rules, and in November, they'll become effective again, but go into effect in 2025. I think, yes, I think our last slide. I believe Sydney put in the chat that we have 7 OAC members who have expressed interest in participating in the RAC and at least 2 alternates. So we appreciate everyone who's reached out, but please don't let that keep you from participating. Everyone's welcome. If you do want to be on the RAC, please reach out to Sydney because I think we could definitely always use additional alternates, especially as we get closer to July. And I know people's schedules fill up. You can also attend the upcoming community engagement sessions that are happening next week and that RAC in July. And finally, today, we're asking that you provide input or ask questions as we name each rule today. We will be taking notes in kind of a live feedback log and of course, recording this conversation. So if there is any questions or our note takers can't quite keep up, we can definitely go back and watch this video to make sure that we capture everything. Thank you. So I think now we were going to bring up the Division 101 rules to the screen and give folks just a little bit of time to orient themselves, and we'll kind of go in order, taking feedback along the way. And I can share my screen to show those. Okay. Hopefully everyone can see these and they're big enough. Apologies if they're a little bit small. And hopefully someone can help me see hands if they go up, because it is hard to sometimes see hands when you're sharing your screen. So the first section of rules is the Chapter 944 Division 010 rules. And the first title or rule 944-1010-000 is simply the purpose and effective date of the rules. And I will pause here to see if anyone has any feedback on this first kind of set of this first title of rules.
I don't want to keep us holding up, but I do have a question really quick, Kristen. So in
Sure.
the bottom part where it says 944/010, okay, it's the second number. These rules,
Mhm.
does that, so those are the rules that only apply until July 1st, 2025?
Yes,
Okay.
these are the current rule numbers. And they will apply through July 20. Well, these are the new rule numbers, and they'll apply to burn providers authorized to provide services on and after July 1, 2025. So what that means is that, these changes won't affect currently funded Measure 110 grantees. I think I see any hands, so I'll keep moving along. I know this is kind of a lot, but this is Chapter 944-010-0010, and these are the definitions. So these all are explanations of keywords that are found later in the rules, and then that get referenced throughout administering the grant program. So we list the ASAM criteria. We define the Oregon Health Authority, behavioral health, burns, contingency management, culturally and linguistically responsive services. I'll just read these all quickly and then we can go back if there's comments. Culturally and linguistically specific services, diagnosis, Diagnostic and Statistical Manual of Mental Disorders, or DSM, employment support services, gender affirming care, individuals or persons with a substance use disorder, individual intervention plan, organization, peer delivered services and supervisors, substance use disorder treatment, and the reference again, kind of back to the rules. So I'll just pause there and see if anyone has comments on any of the definitions. And Dharma, I see your hand is up.
Yeah, I had one question on number 7, where the standard has this, it's the last sentence here. These services are primarily led and staffed by people that have extensive experience working with or being immersed in the same minoritized cultural community they serve, or have a history of at least 5 years, primarily serving the specified minoritized cultural community in a behavioral health setting. Is the 5-year, where's the 5-year coming from? I guess it's like I'm not seeing that on like the national CLAS standards. I'm wondering where they're getting that from. I just feel like it might be like a barrier to newer organizations since we've had such few culturally linguistically specific service providers and such little access to those kinds of services in the past. I think that a lot of newer organizations would be discouraged from applying if they didn't have the 5 years. And so I'm just wondering like why that's there. because it feels like it might just take away from their experience if they're already immersed. But I know that it does say like or have a history, but I just feel like that might be putting some organizations at disadvantage.
Thanks for that feedback. This definition is one that I believe we use in other OHA and behavioral health programs. But again, like as you mentioned, that kind of or kind of gives some wiggle room that it's an either or, not a both. But if you have a suggestion on that 5-year piece, we'd be happy to take that down and consider it.
I did yeah, I would just recommend removing that altogether. But then I did have a question about the gender affirming care definition.
Mhm.
So in the definition, it includes intersex people, and they're not a gender. Like throughout the documents, they refer to them as a gender population, and it's a sex population as well as a disability population. So my concern is that the conflation of the two is like medically incorrect, but it might also ignore that they have a disability. And so I'm just wondering if it should say gender and sex affirming care throughout, or if there should just be a separate policy for the inclusion of intersex people since they're listed there. Just making sure because the gender affirming care policies and non-discrimination laws would be different for intersex people since it's sex-based discrimination, and maybe disability related discrimination since it's related to a medical condition.
I would have to double check. I think this is maybe one of those definitions that we did not change from previously, but we can definitely take that comment down and relook at it.
Yeah.
Thank you.
And then one last thing, sorry, and then I can let someone else go.
Sure.
But on that policy too, I'm wondering, it does say like it affirms their respectfully affirming their gender identity. I know that this isn't one that changed, but I'm wondering if we can have an addition to that says like regardless of their progress in medical transition or legal transition, just because what we're seeing a lot of is individuals who maybe haven't transitioned like their name or something like that, or their paperwork yet hasn't changed over, will get discriminated against in accessing care. And so just to avoid that, maybe adding in a caveat that it's regardless of their like how far they are into their transition. And that's it.
Thanks, Dharma. We'll mark that down as well. Keisha, I see your hand.
Yeah, I wanted to go back to the culturally and linguistically in the 5-year thing.
Mm-hmm.
And I guess I might be interpreting it differently, but I kind of like the 5-year thing when like white organizations say they have like these cultural and linguistically organizations, but haven't really dealt with that population. Dominant culture, dealt with minority population. So I guess I'm interpreting it differently than Dharma, but I could be wrong.
No one's, I don't think, wrong or right. It's just sharing your feedback. And so we'll make sure we mark that down too. Thank you, Keisha. Are there any other comments on the definition? Okay. We will move on then to chapter 944 dash 010 dash 002 titled Operational Policy and Service Support Requirements of the Behavioral Health Resource Networks. And this section provides operational policy and service and support requirements for the burns A lot of these are inclusive of what the council already put in originally writing these rules. But essentially this section stipulates what any entity who receives funding under the Measure 110 program must do, including maintaining and formalizing policies and procedures for those 12 categories that you all defined previously, maintaining adequate staffing, some spelling out what that looks like a little bit. Again, I don't believe that changed a whole lot. Maintaining partnerships and clear referral pathways. I don't think that also changed very much. And a lot of the changes were just kind of cleaning up things and maybe moving them around. But these are some of the operational policy and support requirements of the burn. Dharma, is your hand still up or newbie up?
Oh, it was just up from earlier. Sorry.
Okay, no, you're good. You're good.
I guess I have one question on this one though.
Sure.
When we first set up this section, I originally proposed that they include referrals to like scholastic recovery programs, so like where relevant or appropriate. And because we have the expanded Oregon Recovery Schools programs coming out, I'm wondering if we could include that here, just because it makes it easier for recovery schools to apply for funding if they're included in language in these kinds of rules. And so I'm wondering if we can include that in either under youth services, like youth services, including referral to appropriate recovery school settings where, or if we can just include that as an additional thing that's like a referral and coordination with agencies to coordinate for school access in a recovery school if appropriate.
Sure, we'll put that suggestion down. Thank you. Any other comments on the operational policy or service and support requirements of the burns?
I had a question. Like I see everything on there for cultural and gender and like pregnancy, children, but I don't know, I might have missed it. I don't see anything on there for like veterans. Like you mentioned veterans, or this is a place where it would be.
Yeah, veterans is not on the list of policy and procedure areas that was originally kind of written, so that is not on there, but we can definitely take down that recommendation. Thank you.
You're welcome.
Sabrina.
Yeah, I'm looking at L2. I
Mhm.
think that's how you say it. So it says each entity must, each entity. So did this change from the last time, or is this the same language from previous, from the regular chapter 944 rules? Or is this new language?
Jen, I'm hoping you can hop on and help answer that question, since I don't have enough screens to cross-reference everything.
And the reason why I'm asking, just so that we can get on with the conversation, is because I know before, like the the staff had to be like a recovery mentor. I think Keisha might be able to speak to it a little bit more than I can verbalize it, but there was like certain positions had to have certain certifications to hold those positions. And so I was wondering if this was the same language or if this is new language.
Yes, I believe that this is the same language from prior. It may have been lightly edited, but while we're in this discussion, I will cross-reference the current rules and drop that in the chat. Does that work?
Yes, that works. Thank you.
Yeah, thank you.
Thanks, Shannon. That's also my recollection, but I don't want to misspeak. So we're fact checking in real time for you. If
I think-
you
Sorry, Kristen, I didn't mean to interrupt you. I think the rest of the actual bullets answers my questions because then it goes into talking about what each position must be for each service element.
Yeah, and that's exactly what I was going to say. These are all kind of subcategories under 2. So the qualified service providers are kind of defined here, and I don't believe those change, but we'll make sure. Okay, then we can move forward. We'll make sure we put that answer in the chat. But this is chapter 944-010-0030. The title of this rule is screenings, and this provides the criteria for screening services. So previously in the 944 rules, all of the service elements were kind of compressed into one section. One of the things we did was break them into separate sections so you could clearly see this is a screening, these are assessments, this is housing, treatment, peer services, et cetera, et cetera. So that's why this looks a little bit different. But the substance of this is largely unchanged from the original rules. So this particular rule just outlines at a minimum what screening should cover, including acute care needs, treatment for substance use disorders or coexisting health problems, personal safety, harm reduction, addiction peer supports, housing, employment and training, childcare, food and other basic living needs, and the need for and provision of mobile or virtual outreach services. It goes on to say that screening services must be provided or available 24/7, but it does clarify that a burn can rely on the statewide telephone hotline for screenings during non-business hours, and that reflects a change that was made in House Bill 2513. It also goes on to say that once screening is completed, an individual must be provided with referrals to all requested and appropriate services and supportive services if that individual is waiting for things that are not readily available, and calls on a case manager to work with the individual to design an individual intervention plan if after the completion of the screening, that individual indicates a desire to do so. Meredith.
Sorry, I thought I put my hand up earlier. It was for going back to 2B on 220. It was right where you were under question 2, where it's under case manager. It's a certified, notice like for, sorry, we should go back to it.
Yep.
Yeah, so right there you said you put like an addictions peer specialist support certified by their authority. So case manager, it's like that's kind of, I don't know, it just seems weird. It's like case manager, it's like what is their certification? Are we saying by their, certified by their authority, or because I guess any, would they be certified by MACBO, or are they going to be certified by the addictions as addictions counselor, like a CDAC 1, CDAC 2, CDAC 3? It's like, what are we just determining as a case manager? Who is a case manager? I mean, is it somebody with BA, somebody master's, somebody like, who is that person?
In the absence of clearly defining it, I think it is open, it allows for some flexibility in terms of what qualifications or certifications that person has. But if you have suggestions on what you think would be appropriate, we'd be happy to take those down and consider.
Gotcha. Because there is a certification for case managers. So just kind of thought that that might be up there, but.
And that looks
That
like
was
that was not one that was defined previously. So definitely would welcome any suggestions that you all have in terms of how to further clarify that.
Which it, yeah, might be with the mental health, the MACBO, the case manager, or the case manager board of their certification, whatever that, but this is substance use, but I don't know if that case manager title goes under substance use or not. Because you either get certified as a CDAC 1, CDAC 2, or MAC, Master's Addiction Counselor. Really called case manager. Sorry, just stumbling. That one just kept stumbling on me. You know, for me, it's like,
You're good. You're good. Thanks for that feedback. We'll make sure we get that down and we can look into it some more.
Okay.
Can I just ask a clarifying question just for, I'm taking down these notes. Is there a difference between a CADC and a CDAC? Are those different
Yeah.
acronyms?
No, a CDAC is a 1, 2, or 3, but if you're a 3, it is now actually called a MAC. It's a Master's Addiction Counselor.
Okay.
So the CDAC 3 and MAC are the same.
Okay. But CADC is what you're calling CDAC. I just want to make sure.
Yes, yes.
Okay.
CADC,
Okay. Thank
sorry.
you. Thank you.
Is a 1,
That's
2, or
okay.
3. So
No,
sorry.
it's okay. I just wanted to make sure I wasn't missing an acronym. So no worries.
No, you're
Thank
right.
you for clarifying.
Yeah, you're welcome.
Thanks for clarifying for me. I want to make sure we get all of this feedback down as accurately as possible. So. Does anyone have any comments on the criteria for screening services? Yes, Dharma.
I don't know if we need to reference it because it's its own administrative rule, but I'm wondering if we should make reference to the screenings data, like demographic collection, should be in line with the chapter 950 rules that are coming out from the new rules that are coming out with regards to like SOGI data collection and the RealD data collection updates. Because I know that none of the current like screenings use that more inclusive language or options in this assessment tools or screenings. And so I'm wondering if we should make reference to our providers needing to like kind of keep up to date with the 954 rule or the 950 chapter 950 rules.
I cannot remember if we references later or if not, but if not, we'll definitely take that comment down. Thank you.
Is Jay the last one?
I'll
No.
scroll. No, just talks, the rest of it talks about how screening services must be available 24/7. And that referrals must be offered, and an IIP if people express an interest in that.
So I don't have my hand up, but the one above, number one.
Mhm.
So are we addressing, like mental health, and like emergency care, like their transportation needs, like if some?
So this is a minimum of what a screening has to cover. Organizations can definitely ask for additional things, and we can put those suggestions down up front. Thank you.
Mhm.
Okay, we can keep moving through these. And always happy to go back if people think of things. This is chapter 944 010 0040. The title of this rule is Comprehensive Behavioral Health Needs Assessment. And this section provides the criteria for assessment services, which is a separately funded service. Again, I don't believe that this definition changed much, but this outlines that comprehensive behavioral health needs assessments must include substance use disorder screening to determine if an individual has been appropriately diagnosed with SUD or other co-occurring disorders. I don't believe that language has changed. Assessments or diagnoses must be conducted by a certified alcohol and drug counselor or other credentialed addiction treatment professional acting within their scope of practice. But an assessment must prioritize the self-identified needs of an individual and must be provided within 24 hours of a request for an assessment. When an assessment identifies a co-occurring disorder, the grantee must document that finding and provide appropriate referrals. And also talk a little bit about case management services to be provided to assist individuals to connect and gain access to needed services and supports. And Sabrina, I see your hand is up.
Yeah, I've always had a question about, I'm trying to find out which number it is where it has 24 hours before. I think it might be 3A where it says be provided within 24 hours of an individual's request for an assessment through a burn or statewide telephone line. I'm always confused of what that means. Does that mean they have 24 hours to get their assessment, or is that just for the screening? And maybe we can define that.
So currently it is if an individual requests an assessment that provider or burn provide one within 24 hours.
And I just want to say I work at a drug and alcohol treatment center, and I don't know how realistic that is. Ideally, in the perfect world, I'd love for that to happen, but also I think it's with the workforce shortage, I don't know if that's being done or if it could be done.
Do you have suggestions for what might be a more appropriate timeframe?
If I had a magic wand, I'd say within a couple of days at least, right? But I know some providers are booking out 2 weeks and they have 2 people running, an organization trying to kick them out and stuff. So I would leave it to other people to actually complete them. I think it should be done as soon as possible. And I think if people are accepting the burn funding, that they need to prioritize, hey, you're signing up, agreeing you're going to complete this in a reasonable amount of time. So to put all effort forward to completing it as it's said in the chapter rules.
Thank you. We'll make sure we get that feedback. Annalise, I see your hand.
So this may be a naive question that you all know, but along those lines of where Sabrina was going, how are these monitored or assessed, or how does OHA oversee these components now?
So we currently help our funded partners understand the requirements of the rules, and we monitor their expenditure reports and data reports to ensure that what they're describing they're doing are in alignment with these rules, not these rules, but the current rules. And finally, you know, as kind of just a matter of compliance, if we receive community complaints, or information that suggests providers aren't following these, we work to provide technical assistance to understand if there are barriers that are preventing people from following these requirements, help educate them on what tools or what they should be doing, and have a variety of kind of grant administrative tools that we can pull to help generate compliance. That said, I think we also recognize there are a lot of challenges, workforce challenges. The reality of this funding is that it's never going to be enough. And we really try to lead those conversations with respect and compassion, recognizing that some of our providers are doing the best they can, to Sabrina's point, and cannot keep up with the demand. That's kind of the short answer.
So, I mean, I think this obviously deserves further discussion, but I think it would behoove us all to think a little more realistically then about what we're asking of our burn providers, right? Like, and I guess we'd have to look at the statute to see, but this is like, we want these to be CCBHCs, right? Like, there's a lot in here. So I'll just throw that out there to maybe put a pin in this section in particular.
And I think if folks have suggestions on how to make this more realistic or achievable, this is definitely the time to bring it up, along with community engagement and the RAC and kind of these other opportunities. This language is largely unchanged from the original rules that I think this council originally wrote. But, you know, I think there's been a lot of lessons learned and kind of wisdom gained over the last few years. And so if you all feel strongly that a change in direction is needed, I think we're happy to take that feedback.
Can I add something else really quick, Kristen?
Mhm.
I'd be interested in knowing and I don't know if you guys can gather this data, and maybe it's too heavy of a lift, right? But how many providers were actually able to, in the state of Oregon with the last funding, was able to actually get an ASAM done within 24 hours? I also think that we need to have accountability for our partners, you know, but I also, like I said, realistically with the workforce, how often could that happen? So I think it's a and both, right? To get the need met as soon as we can and take in consideration that, you know, what that's going to look like.
Absolutely, that's a good suggestion. Thank you. Amy?
Sabrina was saying that within 24 hours of getting an ASAM done, do you mean that providers getting it done or getting them in to see somebody?
Amy, I was just paraphrasing off of the rules where it says that it's supposed to be happening already within 24 hours and ASAM is to be completed, from my understanding.
Okay. And the reason I was going there is because, you know, in the where I'm at in the practice, we get our ASAMs done in 24 to, if they're more detailed, they're 48 hours, but at the most. But they're usually done within 24 hours. So, but when we're in rural areas, and we got to remember that a lot of Oregon is rural too, in rural areas, it's hard to get into a provider within 24 hours or get those done. Now, I know the burns have supposed to have CADCs and stuff in them, but you know, we just have to be mindful with that time constraint. That's all.
Thanks, Amy. Can make sure we put that down as well.
Yeah, I was just gonna add that the ASAM could take anywhere from an hour to 2 hours to complete per person. So they're pretty in-depth. In some places, you might need to have them sign off as a medical clearance, saying they're medically cleared to be able to be into a program. And if that's the case, it slows it down a lot more because the substance use provider has to reach out to the medical provider to get their okay. So it kind of takes a little bit longer. So 24 hours would be a really hard turnaround.
Meredith?
Hmm?
I said, thank you. Sorry. The
Oh.
pollen outside in the Willamette Valley today is trying to kill me. I can feel
You're
my throat
welcome.
closing. Thank you for that feedback.
Oh, you're welcome.
Linda?
I was just wondering, it says or statewide telephone line. Is the statewide telephone line able to do these within 24 hours? And can those assessments, I guess, be used to get people into treatment?
My understanding is that the statewide telephone line can do them. I would have to get back to you on their timeliness, but my understanding is that there haven't been delays, at least that have been reported to us. And they should be able to get people into treatment as long as they're following these rules, using a credentialed professional acting within the scope of their practice, and performing a full ASAM.
Okay, so I guess theoretically for providers who are rural or have a really long wait, they could refer people to the telephone line. I guess my thoughts are the sooner we can encourage people to get their assessments done, the better.
Yeah, and we have specifically reached out to providers to let them know about the availability of the hotline. But that's good feedback. Yep. I think I saw Sabrina and then Keisha.
Yeah, I just want to say, Kristen, and I've been on the council for a very long time. This is like a hidden gem, right? I did not understand that the phone line could be performing ASAM assessments, because then there's no reason people can't be connected in real time. So waiting for 2 weeks is unreasonable to me in my mind, thinking about it now, because if they can just get the ASAM, that's the biggest obstacle. And so I just want to say that made me happy to hear that. And I never knew that this whole time.
Thank you. Keisha.
Yeah, I was just gonna say that yeah, I've been on the council for a long time too, but the 24-hour was the goal. Like, we knew in the beginning it couldn't be done, but that's why we were providing money and resources, because it's about the person and we're trying to get them the quickest access. And if you give too much leeway, like, the person who's needing services is suffering. So the main goal was to get it done in 24 hours.
Thank you, Keisha. That was my memory too. This is really good feedback. Definitely a lot for us to think about. So appreciate everybody who has chimed in. Is there anything else on the comprehensive behavioral health needs assessment portion? Okay, move on to chapter 944-010-0050, titled Ongoing Peer Counseling and Support. This rule provides criteria for peer services. as with the previous two sections, I think this is largely unchanged. I think we just made a few references, cross references to other pieces of the administrative rules. But this section stipulates who can provide peer counseling and support services, and that the entity providing peer counseling and support must have supervision for those peers, and specifies that peer counseling can also include employment support services. So we'll pause here, see if there are any comments on the peer counseling and support section.
I apologize, everybody. I was not, I didn't have the chat open. I didn't realize it. And there's a couple, do you want me to wait till the end to make sure I'm catching the rules properly? I apologize. I wasn't even getting notifications or anything about the chat, so I apologize. Do we want to, I'll do it at the end, or I'll reach out to people if I need to. That's fine. Ignore me.
It's okay, Sydney. And I know I can't always see the chat and hands as well, so please just interrupt me. Not seeing any hands on this section, we can keep moving. The next rule is division or chapter 944-010-0060. The title of this is Harm Reduction Services, Information and Education. And this section provides criteria for harm reduction services, and really just spells out that harm reduction services provided by a funded provider must be low barrier and reduce the negative individual and public health outcomes of substance use and substance related harm. It also spells out that some of the harm reduction services, but it is a include but not limited to list of services and referral information. So I will pause here and see if anyone has comments on the harm reduction section. Sabrina, I see your hand is up.
Yeah, so for all the services that will be provided from A to I, so if somebody's just supplying a naloxone, would that be good enough in this to complete this section? Like as part of the service element?
I think based on this language, access to naloxone is one of the harm reduction services listed, but not limited to. So that would be enough to kind of qualify as providing harm reduction services. Yes.
Kristen, can I speak again? It just makes me a little bit nervous because then I don't want to just say just because anybody, I want to say respectfully that people that are handing out naloxone then can consider themselves harm reductionists. And I know that they are, but then they can go on the application. If they're completing naloxone, they could check that they're a service provider and request funding for the harm reduction funds as part of the service requirement.
They could. I think, it would be then up to the council if, that is all a provider was doing, that you wanted to award them funds, or if you wanted to, instead award funds to a different service provider who's maybe providing more of these services, right? So I think ultimately that would be up to you all. Okay, I don't see any other hands. So the next section is chapter 944 dash 010 dash 0070. The title is Low Barrier Substance Use Treatment. And this chapter division number provides criteria for substance use treatment services. And this spells out that an entity who is providing low barrier service substance use treatment cannot have programmatic barriers, exclude individuals because of missed appointments. They also must provide treatment services with little to no wait time. So we define that, or I think the council defined that as no more than 48 hours after a screening identifies that need, regardless of an individual's ability to pay, regardless of an individual's criminal history, state residency, or citizenship. States that the providers offering the service must engage in outreach, must offer individuals using substances by injection information about the risk of that counseling, of bloodborne pathogens, counseling for pregnant people, and also providing treatment that is without stigma, that is trauma informed, regardless of active use, is culturally and linguistically specific, uses a harm reduction approach, is individualized, provides unique recovery trajectories, includes medication if appropriate, and addresses any transportation barriers. And I think this again is largely unchanged from the original rules. So I'll pause there. Any feedbacks or comments on the definition of low barrier substance use treatment?
Oh, sorry, I tried to raise my hand.
Nope, go ahead.
So it says must not have a problematic barrier such as lengthy intake. Well, the intake normally is based on the provider doing the ASAM and whatnot. Don't understand how that would be based on something that from the patient perspective, or am I reading that wrong? It just seems kind of strange sitting out there. Like, what does that mean by lengthy intake?
We can definitely take that comment down and see if there are further definitions, but would be curious if you have any specific suggestions, or anyone else here has ideas on defining that.
I'll take a stab at it. So I think what it means is like when you're getting ready to do the assessment with an individual and some of them will go off on a tangent and you'll be sitting there for hours trying to get the intake done. And you don't want to be rude to cut the people off, but you have to have some kind of cutting point so that you can get the assessment done.
That's true. That would be based on the provider though. Trying to redirect them,
I thought it meant not making the intakes too long for the participant.
Right. So that they don't have to be, if they start doing, well, I think it's for the participant and for whoever's given the assessment. That way they're not there spending a whole bunch of time trying to get it done.
Well, low barrier, we're the ones, it's not really concerned about the providers. I mean, we do want to concern about the providers to make sure we have decent COLA, but their job should be there to serve the client. I would think the low barrier the intake should be based on they're already traumatized, they're homeless, they're on drugs. They probably don't want to answer a million questions. Let's make it as short as possible.
Yeah. Because it almost seems like it's to me, it just reads this negative for the patient. You must not have this, like, I don't know. It's like appointments seem like sometimes, people may have other things like for their medical and stuff. And it's almost like, it seems like a deterrent. Like, if you have these things, you're not able to go into treatment. Maybe I'm reading it wrong. It just seems like
it says have programmatic barriers such as lengthy intake. It's saying you don't need to over ask the client a lot of stuff that doesn't need to be asked. It needs to be low barrier. That's what it's saying. Don't make it excessively difficult or complex to give the participant an intake.
I don't know if this is helpful, but when I had my Google alert, there were a lot of reports from the public citing things like waiting periods, or like it says a lot of appointments or something like that. Like that is what they're talking about by lengthy intake. They want a quick turnaround. You shouldn't have to have 2-week waiting period to find out if you're gonna be accepted into treatment and stuff like that. I think that's
yeah, that makes sense.
I think that's what we're trying to prevent.
So it'd be quick turnaround. Okay. All right. It just kind of like it's read awkwardly, but yeah.
But maybe if we could wordsmith that just a tiny bit to put into words what it actually means, so there's no discrepancies.
Intakes over, multiple day intakes, the intakes less than 90 minutes, kind of. And excessive appointments, like requirements.
So do you all suggest removing the lengthy intake? Is that the comment?
Mm-hmm.
Or clarifying
yeah.
that letter A. Okay.
Sorry, guys.
Thank you for clarifying.
And thank you for that comment.
Yeah. Thank you, Melinda. And Anisha.
Keisha, I see your hand is up.
Yeah, I'm just trying to figure out if we should take out lengthy. I guess my interpretation of it too is that it not be a lengthy intake, because intake and assessment is two different things. And we want to keep it short and sweet.
Very true.
And I would agree with Lakeisha on that myself as well.
Thanks, Keisha. Thanks, Deb. I'll make sure to put that down. Sabrina.
Yeah, I just have one more kind of like a comment. I'm not sure how much wiggle room, and I'm all about low barriers, so don't get me wrong, how much wiggle room the clinicians actually have to make it shorter than it needs to be. I've never done an intake and an ASAM and all of these things at one time, but I do see how burdensome it is to the client that's trying to get the services done, and they're agitated, they're tired, blah, 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 all of these other things. And so that was just my comment.
Thanks, Sabrina. Keisha, is your hand still up, or do you have something else?
Nope, I gotta put it down.
You're good. Just want to make sure that we give you a chance to talk. You have things to say. Deb.
Well, I'm on now. I'd like to say too, like when somebody's coming in and they're in full detox, or they got, a massive open wound or something, like you don't need a full ASAM assessment to be done to meet the needs of the client in that moment. So I think, we all hope that people are on staff there to meet the acute needs of the individuals who are coming in. But yeah, if you hand somebody a stack of papers or something like that when they're in, a state of detox or something like that, it is a huge barrier. So I just want to kind of add that too. And, with the ASAM in 24 hours, like sometimes the ASAM process could be a barrier for somebody that's not stabilized.
Thanks, Deb. Onisha.
Yeah, I just want to put this on the record because I know I missed some of it because I had to hop off and deal with one of our recovery houses. But is this where I can request to put making the complaint flyer mandatory? Because when we asked for it to be made, that people have the QR code to make complaints about Measure 110 sites, we said we strongly suggested it, or we use some language. So a lot of our area partners don't have it up, and when I asked about it, OHA staff said that's because the language said that we suggest. So I kind of find that problematic. Miracles Club has it up because if we're doing something wrong, or our staff is doing something wrong, we want the client to know they have the right to grieve and complain. And I would like that language implemented if possible. Is this where I would do it at?
Sure. There is no any time today. So yeah, we'll definitely take that down. Thanks, Anisha.
The language would be changed to required to post in a public community setting of the org.
We have that down. Thanks, Anisha.
Thank you.
Mm-hmm. Are there any more comments on low barrier, the definition of low barrier substance use treatment? Okay, we can move on to chapter 944-010-0080. The title of this is Transitional and Supportive Housing for Individuals with Substance Use. And this rule provides the criteria for providing housing services. So this rule or draft rule stipulates that entities funded to provide transitional and supportive housing must conduct an assessment of an individual's need for that housing, and that entities must provide at least one of the following types of transitional or supportive housing based on that individual's assessment in order to serve individuals at all points on the substance use continuum and across the gender spectrum. And the listed types are emergency housing, family housing, permanent housing, recovery housing, supportive housing, transitional housing. In addition to the housing services, the rule goes on to say that an entity must offer rental assistance, including Section 8 vouchers, tenant-based vouchers, rapid rehousing or eviction prevention, assistance for fair market rate privately held housing, and assistance to wraparound services or assistance directly paid to individuals. And again, I don't think there are many major changes in this section from the original rules, but I'll pause to see if anyone has any comments. Any comments on the housing section? Not, we can keep moving. I think we're almost the last page here. Chapter 944-010-0090 is titled Data Collection and Reporting Requirements for Recipients of Grants or Funds. And this rule provides the requirements for data collection and reporting. So these rules stipulate that any entities who receive funding must keep accurate books and records in accordance with generally acceptable accounting procedures that are subject to inspection and audit by either OHA or the Secretary of State Audits Division upon request. That entities conduct a single audit performed by an independent certified public accountant after the first $1 million of grant funding has been expended and annually thereafter for the duration of the grant. And that an entity who receives funding must collect and provide in a format specified by OHA the number of individuals, numbers of individuals served, duration, outcomes, the individuals seeking assistance who are denied or not connected to services, average wait time, whether average time has increased or decreased since funding. Here, Dharma is the reference to the 950 rules on the individual demographic data. And a lot of this language is both from either statute or the previous rule language. So I will pause there.
What has changed, Kristen? You said a lot of it is the same, but what's different?
So I think two things that OHA is adding in that are new are to clarify that, make it very clear that both OHA and the Secretary of State can audit upon request, and to the requirement that an organization conduct a single audit and annual audits after the first $1 million of grant funding has been expended. And that would only apply to people who receive $1 million or more.
So is it an audit you want us to hire like a comptroller to audit or a financial institution to audit it?
That's correct.
Okay.
An independent CPA. Yeah.
Will we be able to write it in the funding to request that funding for the audit?
Yep.
All right, perfect.
That'd be an allowable cost. Sabrina.
Yeah, I was wondering if the language looks similar from before, letter D and E. And I was wondering, are we tracking that now, and how are we going to continue to track it, or what does tracking it look like in the future?
Sure. So we currently ask a question of grantees on the number of individuals who are denied services and the reason. And I'm sorry, I'm blanking right now on the time for individuals to access services and reasons for delays. We can
Track
definitely
it
follow
now,
up.
though. Well, I don't know about times or delays, but we do track whether we deny services to anybody.
Yeah,
Every quarterly report, you ask how many people were denied and the reasons why they were denied.
that's correct. And I don't believe we have asked about average time accessing services. I think we are still figuring out the best way to be able to collect and track that information.
Can I ask for C, individual outcomes? That seems very broad. What kind of data are people reporting for that?
That is not something we're currently collecting because we don't ask any providers to collect or report on individual client level data or outcomes, but that is in the statute, which is why it's also in the rule.
Can we, since it's in the statute, I don't know how much we can change the wording, but can we clarify what we mean by outcomes?
I think if you have suggestions, we can definitely take them under advisement. But I think without
I
being
can
able to
tell
track
you what we
individuals.
collect.
Yeah, go ahead.
So miracles collect improved housing, stop smoking, length of clean times from 30 days to 1 year, obtained their driver's license, reconnected with children, completed treatment, completed detox, obtained employment. What else do we collect? Oh, found a primary care provider. Yeah, there's a whole list of things that we collect with our data.
Anisha, that's amazing. I mean, I think it would be great if more organizations were collecting data like that. I would add to her list, like, started medications for substance use disorder.
Thanks for sharing that, Anisha, and that suggestion, Linda.
I sure will. I'll send it to you, Kathy.
Thank you.
Anything else on data collection or reporting requirements?
I just wanted to say, I think, because the data collection, this is all stuff that is going to be required, right?
Yes. Yes.
So for the outcomes, I feel like we don't want it to be anything overly burdensome to organizations, but I do think it would be great to highlight some like really important outcomes that maybe like we all care about.
I think we'd welcome any suggestions on feedback on what those might be. I know Anisha gave a great starting list. Okay, well, that is the end of the 010 division. So I'm gonna stop sharing my screen and tee up the 020. These are a little bit shorter. So hopefully we can get through them. I do see, Ryan, though, you have a question that if burns are or can be a collection of organizations, a burn can just be a singular organization if they're the only funded organization in a county. Otherwise, it's a collective of organizations within a county that provide all of the services. There is not an electric record keeping requirement given the diversity of grantees that are funded. I think it's going to look a little bit different if you're talking about a health system or a CMHP versus a street outreach provider. So there is no kind of universal electronic record requirement for partners. So these are the Division 020 rules. They are more about the process for funding future rounds of grant funding that would start in July 2025. As a reminder, these current grants end June 30th, 2025. So these new grants would pick up the very next day. Hopefully meaning there's no gap in funding or services for folks who are selected a second round. The first division is Chapter 944 -020-0000, and this is the grant application process for drug treatment and recovery services funds. This section kind of outlines some of the things that are going to be in the grant application. Again, as a reminder, House Bill 2513 kind of shifted the application writing to OHA, but the council will still be the ones who are deciding. You all will be the ones deciding who receives funding from these applications. So these rules state that we will announce the availability of funding and provide instructions for how to apply. The announcements of funding will include, kind of at a minimum, a description of the fund, the available funding, eligible services, the terms of the grant, the effective dates. We'll provide a template grant agreement, budget, declaration of covenants to secure property if applicable, application criteria, reading criteria, and other application materials. The application will include a detailed scope of work, documentation around the applicant's experience offering the proposed services, including the kind of 12 policies and procedures that we mentioned earlier. some questions around if the applicant is a past recipient of Measure 110 funding, a detailed operating budget, detailed operating plan, the number of employees that would be funded under the grant, some documentation about how applicants work with other organizations, if applicable, any kind of information, kind of background information about managing or previously accounting for funds, collecting program experience collecting data, whether the applicant has experience working with Excel or if the applicant's a nonprofit and in good standing with charitable activities division. Some other kind of requirements around commercial liability insurance, billing, previous grant experience. Goes on to say that applicants will be reviewed by OHA staff to determine if they meet the initial minimum criteria. Applicants will be notified in writing if they don't and can appeal that decision. The appeals kind of at the end. Applicants who meet the minimum application criteria will be reviewed by a review panel. And that review panel will include at least 3 members of the council. All members will be screened for conflicts of interest and make recommendations for funding decisions to the OAC. So I know that's a lot. I'm trying to get through it fast so that we have time to discuss. But Sabrina, I see your hand is up.
Yeah, I had 2 points. One point was, or one question, Kristen, was, so one of the questions said that something pertaining to, are they a previous Measure 110 grant recipient? So we're allowed to take that into consideration if we wanted to?
We have not, I don't know if we know the answer to that question yet. We're
Not
still
yet.
writing the RFGA. And so whether we're going to recommend that that be kind of a scoreable criteria or not remains to be seen. You know, at the end of the day, the funding decision, though, will be all of yours. So I think anything and everything could be fair game.
And I forgot my second question, so thank you.
Very good. If you remember it, just call out.
I did have a question. How is the review panel going to be picked?
I don't think we know that yet. Good question. You're seeing things happen in real time. So, you know, I assume we'll call for volunteers similar to as we did with the RAC and kind of a lot of these other things. Any other questions on kind of this application criteria, recognizing that, you know, you will actually have an application to see, hopefully in the coming weeks. That'll be a lot easier to understand how this all fits together. Okay, we only have a few more pages, so we're getting close to the end. Appreciate everyone's patience hanging with us. The next section is chapter 944-020-0010, and this is the grant application review criteria. So the grant review panel will review and evaluate each grant application based on, well, I guess I answered your question, Sabrina. If they previously received Measure 110 funding and how they provided those services, their commitment to providing culturally and linguistic responsive for specific services, the commitment of the applicant to serve communities most impacted by the war on drugs, the commitment to work with other funded organizations, commitment to financial soundness and administrative capacity, the feasibility and alignment of their statement of work with program goals and rules, the clarity of their project plan, the number of proposed individuals to be served, kind of proportionate to the funding request, the clarity of their budget and budget narratives, and whether the grantee adhered to all directions in the application. Each reviewer will get an evaluation sheet that results in a numeric score. Any grant applicant that doesn't receive a minimum score won't be considered, but could appeal that decision. And once all the applications have been evaluated and scored, the review panel will meet and provide final funding recommendations to the OAC to the greatest extent possible, recommending at least one applicant in each service area in each county. So again, I know this is a little bit still theoretical, but we're working on kind of what this all means in terms of scoring criteria. So I'll stop there and see if there are any questions.
Mine's more of a comment. I really appreciate a letter K. Just so that way we're getting what we're supposed to use to score and to base our decision on the application without all the extra documentation that slows the process down.
Thanks, Sabrina. Seb.
Thank you. Sorry, I just had a flashback, and last time during the grant reviewing process, like some agencies submitted like letters of recommendation and others didn't. I don't see that in here necessarily, but has that been something that's been discussed?
That has not been, but we could definitely take that down as a suggestion. If you have a recommendation, either way.
Yeah, I just thought since like not all agencies knew to do that, kind of, you know, I would say like have no letters of recommendation, or everybody submits letters of recommendation, you know, either or.
Sure, and I think that could be kind of any materials that aren't required or just kind of put aside kind of thing. Thanks for that comment.
The only thing I would say is, are we going to add any? I don't know how if it's even legally possible for us to do it, but I'm just really you know, disappointed and sad about the culturally specific and other organizations. It hasn't been that many who lost their funding due to possible technical difficulties, ignorance in managing a fund grant of this size. Is there any way we can put like things that will be required that you need to have? You know what I'm saying? Like you may need to have a functional accounting and functional, you know what I'm saying, board and a functional, I don't know, whatever it is that got some of the organizations in trouble that could have been fixed had they had the right people around them. And I don't know if there's any way we could implement a non-disclosure like that, if that's even possible.
Yeah, that's a good comment, an observation, Anisha. I think some of these some of the documentation in the previous section will hopefully get to that, such as experience managing or accounting for previous grant funds, whether they have an accountant on staff, and a system, identified a system for tracking receipt of funds, I think we asked the question about Excel because that's a tool that OHA uses, just familiarity with that. Trying to tease out some of these more operational components that are important to ensure that organizations can fulfill kind of their scope of work. So hopefully we can get a little bit more of that information up front to be able to help your all's decisions in terms of selecting grantees that are well positioned for fulfilling the terms of the grant. I think we're
Thank
trying
you.
to, I think we're trying to strike a balance between not being too heavy-handed and dictate business practices and expect nobody be able to meet these criteria, but also, a little bit have some basic kind of level of criteria, so that people are just successful at this. So if we've kind of missed that balance, I think we want to know. But that was kind of our goal here.
And also, if we can share with them a sample of the data that you guys collect, because I know for me, being on the OAC and working at an org that received the funding, one of the challenges, I had to create our documents to catch up to all of the data you collected. So the first quarter, we didn't have it, but following that, we did have it because I had to implement it and put it in the system. But that a small space at the bottom, this is the data that we are expecting, like the gender, the race, the ethnicity, stuff like that. So people can be working in the background to see if they're getting the funding and upgrading their data systems to be ready to collect that data.
Yeah, so that's really helpful feedback. Thank you. I think we only have a few more sections and a few more minutes, so I think we're doing good on time. Chapter 944-020-0020 is just the grant approval process or the process for approving grants. And this just says that OHA will present its funding recommendations to the OAC, which is you all, and any applicants not funded will be notified in writing along with information on how to appeal. Probably the most straightforward of everything we've talked about today. So I'll move on to just the appeals process. House Bill 2513 said that OHA needs to create an appeals process for grantees not selected. So Chapter 944-020-0030 spells out kind of what that appeals process would look like. An applicant that was notified that they didn't either meet the minimum grant application criteria or a minimum evaluation score can submit a written request within 5 days after receiving that notice. The written appeal request must include all of their application materials and a concise statement explaining why they believe they meet the minimum application criteria or should have received a higher score. The OHA director or their designee must either approve or deny that request for an appeal within 10 business days of receiving the appeal, and that decision will be final. Any applicant that was notified they were not funded by the council, so those are kind of like the technical reasons why people were excluded. Anyone who was notified that they were not funded by the council can also submit a request to the council or the council's designee within 5 business days after receiving their rejection notice. The council then must consider appeals at their next scheduled meeting and vote to approve or deny the request and notify the applicant of that writing within 10 business days. The council can also delegate decision-making to a subcommittee or to the Oregon Health Authority. But that decision either by the council or their designee must be final. An applicant cannot submit any additional materials other than those submitted with the application when appealing a decision. And the director, the designee, the council, or their designee could not consider additional materials when reviewing an appeal. And the decision to grant an appeal in favor of the applicant does not set a precedent that has to be followed by either OHA or the council when evaluating subsequent requests. That is it. So if you have any comments about the appeals process, happy to take those now. Oh, and I see, Brian, you have a question in the chat about if OHA has been asked to change or create any rules that would impact decision-making or the structure of the OAC. Not on decision-making, but in 2015, so next year, House Bill 2513 did make some changes to the council to start staggering terms and reappointment terms so that not everybody on the council loses their seat at the same time, but starts kind of staggering seats and terms, and more information about what that looks like will be available when we have it, but haven't gotten there yet. Sabrina, do you have a comment on the appeals process?
Yeah, my comment was just to what you said about the staggering of the terms and stuff So I heard, and we could talk about this later, but I heard before that we were going to do a lottery to get the people re-elected to be on the council for the next term. But I was just wondering how equitable and inclusive that would be if we're doing it by lottery. That's just kind of a comment.
Sure. So the statute, I believe, said so many seats will be kind of renewed, then so many seats will be renewed based on a lottery, and then so many seats will just be have to be refilled. Unfortunately, that was a decision that was made by the legislature, and that is in statute. So I can't really comment to their thought process or equity lens when they were making that decision.
Hi, Kristen. Did you say when the new council would start?
That will happen in 2025.
Okay.
We have a little bit of time still to start planning for that.
All right. Thank you.
All right, well, I think we're almost at time, so we'll stop sharing my screen. And I just want to say a big thank you to everybody who came on this special Wednesday, provided feedback. I know we have a couple people who were taking notes, and of course this meeting was recorded, so we can always go back and watch it. And I just really appreciate all of your really thoughtful and helpful feedback. As someone who's been kind of deep in writing these, it's always refreshing to just kind of be able to pull myself up and re-look at these with a fresh lens. So really appreciate all of you. Sydney, do we have any OHA updates?
I sure do. We are looking so forward to seeing everybody on Friday. I have reached out to everybody who is traveling in tomorrow and adjusted some of those reservations. stuff like that. But if you have any questions, please feel free to reach out. We're going to send out that final detail email after this meeting. We wanted to make sure you all didn't have information overload with all of the rules stuff today, and also that. So yeah, that's I think that's my only update.
Thanks, Sydney. All right.
Oh, be
well,
sure to order your lunch. Don't forget to order your lunch. That's
very
really important.
Very important update. Really, the most important.
Okay, see y'all Friday.
Thank you so much, everyone. Have a great Wednesday.
Bye.
Bye.
Bye.